Good afternoon, and thank you for joining me here on this Monday afternoon as we talk about COVID-19 in Erie County. So since last Friday, we have 6 new positive cases of COVID-19 in Erie County to report. One of the cases is in their 20s, 2 are in their 30s, 1 is in their 50s, 1 in their 80s, and another is under the age of 5. 3 of these cases are located in Zone 1, 1 in Zone 2, 1 in Zone 3, and 1 in Zone 5. And all of that information can be found on the cumulative cases map at eriecountypa.gov. These cases so far are all connected to known positives, and the contact tracing continues by the Erie County Department of Health staff. They've been very busy, as you know. This brings our total to 120 positives cumulatively, 2,680 negatives, and we now have 84 recovered cases. So I'm sure some of you are wondering why the number that we say, the 120, does not match the cumulative number the state is reporting today for Erie County. The state numbers, as we know, includes raw data that's entered into a system by a number of sources. And these numbers sometimes need to be reconciled or verified. And the reconciliation or complete checks and balances of the data is happening on a regular basis, and we have constant contact with the state to do that. Be assured that the staff is working with all of our local partners, and we're very confident that our numbers, the 120, is correct, and that the contact tracing that we have been working so hard to complete since our first case is what is pushing our efforts forward. Every so often, our numbers don't match the state. And typically, after a few days, our numbers align again. So we ask for your patience as our staff at the Erie County Department of Health work with the staff down at the State Department of Health to reconcile the differences. Again, no one is making up any results. No one is hiding any data. We have been transparent with you from day one because we want to keep you updated. We want all of you to be kept safe, and that's why we're out here continuing to give you the information. An update on our surrounding counties show that Crawford County has 21 cases, McKean is still reporting 6 cases and 1 death, and Warren County still only has 1 case. Chautauqua County has 42 cases and 4 deaths, and Ashtabula County now has 192 cases and 18 deaths. The state is reporting 57,174 cases, with 3,731 deaths. Our environmental team was busy, but not as busy as we might have thought over the weekend with all the businesses reopening. But we've gotten several complaints, mostly about personal gatherings and employees at some of the businesses not wearing masks or not wearing them correctly. So remember, your mask protects me and my mask protects you. So here are a few scenarios, and try to stay with me on these because I think this helps to clarify some things. If you're a positive carrier of COVID-19, knowingly or not, and you are not wearing a mask, and if I am not wearing a mask, and we come into contact with each other, the likelihood that I will catch the virus from you is very high. Now, if you are a positive carrier of COVID-19, and you are not wearing a mask, but I am wearing a mask, I still have a pretty good chance of catching the virus if we come into contact with each other. And if you are a positive carrier of COVID-19 and you are wearing a mask, but I am not, there is a slightly smaller chance that I would catch it if we came into contact. But if you are a positive carrier of COVID-19 and both you and I are wearing our masks, when we come in contact with each other, there is an extremely low chance that I will catch the virus from you. So please wear a mask if you go out or near anyone out who does not live within your home with you, and wear it properly. Make sure that it covers not just your mouth, but that it completely covers your nose and down into your chin. So you want that whole space covered on your mouth. Please keep your 6-foot distance. Wash your hands frequently with soap and water, and sanitize your surfaces regularly. Next, I'd like to address something I said Friday about a business who had 6 cases. No, I will not be sharing with you the name of the business. There have been many speculations out there on social media, and rumors are running wild. What I can tell you is that none of the businesses that people have been speculating about across social media, at least that I've heard about or seen, is true. I will remind you to be careful with information that you share. You could hurt a business unnecessarily while we are trying to reopen our economy safely. The best advice that I can continue to give you is to remember that no business and no person is completely safe right now. Continue to act as if everyone that you come into contact with is a potential carrier of COVID-19. The particular business that I referenced last week is not at risk for you any more than any other business. If it were, that business would have likely shut down. We continue to work with all of our businesses to help mitigate this pandemic without shutting them down, but with doing all the necessary things to keep those who visit that business, and particularly those who work there, safe. These employees were identified as positive, and they were immediately put into isolation, and then contact tracing began, and all of the people that they had come into contact with who are at risk were put into quarantine. So if you have not been contacted by the Erie County Department of Health, then you are not one of those individuals who we believe had enough contact with these employees that they would need to be quarantined. The business cleaned their location and have maintained operation in accordance with the guidelines for a business to remain open. Again, this business is just as safe as any other business that you may have gone into this weekend or may go into today or any days beyond. And they are following the same guidelines that we ask every single business to follow. Our responsibility at the Erie County Department of Health, and mine as your county executive, is the health and wellness of our community. We are looking for businesses and patrons to continue to take the appropriate steps to follow the guidance set out by the state and the CDC, and to do the right thing. Finally, do what you need to do to protect yourself. If you feel uncomfortable, which I know a number of people told me they felt uncomfortable this weekend as they went out, then stay home or stay away from any store or location where you feel that way. Maybe there's too many customers there. Maybe you don't see people wearing their masks appropriately. Whatever reason it is you feel uncomfortable, go away, go to another store, or go to the store at a time when it's less crowded. Now I would like to acknowledge a few star players, those model businesses who are doing it right. The Acl Labs on Liberty Street. My understanding is the phlebotomists are wearing masks and face shields. They have only 8 chairs in the waiting room, all spaced out. And you actually have the option of waiting in your car instead of waiting in the waiting room, and then they'll text you when it's time for you to enter. Signs about requiring masks are posted everywhere. Another business is E.L. Hurd & Son. They are selling masks outside of their building during this pandemic, as well as doing everything else correctly that we've asked for in the business compliance guidelines. So thank you to those 2 businesses for being star players in this fight against COVID-19. And now I would like to open it up for questions from our media, and today we will start with Jet TV. Samir, are you with me?
Yep. Hi, Kathy. Happy Monday. So can we talk a little bit about the discrepancy, I guess, within numbers? Can you dive a little deeper for that? So are they taking away cases? Were they, I guess, misallocated towards counted as an Erie County case when they weren't? Can you just explain that a little bit more?
Well, again, this gets really into the weeds, and I'm still trying to understand it myself. But if you saw the state, we have a -1 today. So they already took one of these cases away from the numbers the state had. And now we still have a discrepancy around 3 further cases. And we just can't reconcile that at this moment, but we know we will over time. So it could be a number of different reasons why these cases are currently listed as Erie County cases, and maybe they really aren't our cases. It could be just a number of things. I'm hoping to actually have one of our epidemiologists on with me here, potentially on Wednesday, and I'm hoping that they can shed more light on this. But you have to remember, this is a data system, and anybody who's ever worked with a data system knows there's lots of people kind of dumping information into this data system. We have numerous labs from around the state putting data in here, coming from numerous sources of where they got the testing done, whether it was in a doctor's office or at one of our drive-up clinics or somewhere else. And so sometimes the data just isn't jiving. So, I have a friend, and she always says she's the data queen, and she always tells me there's nothing more crucial than to have accurate data. And I think my epidemiologists also agree with that, and so does the state. So honestly, it is something that is a discrepancy out there that we're trying to reconcile, but we are completely confident that we have the names and the contacts of all of the positive cases in Erie County, and we are addressing that with those people for isolation and quarantine. And I think that's the most important message to everyone listening and viewing, is that we feel confident that anyone who's positive in Erie County has been contacted by the Erie County Department of Health and is now in isolation, or they're already somebody who's recovered.
Got it. And then, so my next question would follow up just regarding businesses. Of course, we know the more we come into contact with people, the more businesses could possibly see COVID-19 cases with their employees. So what is the protocol from the health department's standards, I guess, whenever you do find a business has a positive worker? What's the next step for that business?
That's a great question, and I appreciate you asking it. I want to first say that this, case we had last week with a number of employees was not the first business that we've had this situation, and it won't be the last. There are guidelines that we give every business who's in this scenario, and those guidelines come from the CDC and also from the Pennsylvania Department of Health. And it starts with that the business must, first of all, the employee can't be at work. They have to be home and in isolation. The business then needs to look at their other employees and figure out who's had the type of contact with that employee that would make them a person that needs to go into quarantine. And they also need to be off of work and in quarantine. And I think most importantly is the business needs to really do a good job of cleaning the business, and particularly the areas where this individual worked, to make sure that that area is now not contaminated with COVID-19. So, and the guidelines go much deeper than that, and those guidelines can also be found on our website, eriecountypa.gov. But those guidelines are given to a business whenever there's an employee who has been at work, we believe, when they could have been in that contagious period, which is up to 48 hours before they actually have their first symptom. So we, of course, many people have been in that situation where they didn't know they had COVID-19, and then they have to tell their workplace.
Thank you.
Sure. Erie Times News.
Yes, Kathy, it's David. The cluster of cases from late last week, I think you had it at 6 as of Friday. Has that number gone up since then?
It has not.
Okay, it's still at 6. And if you can explain in a little bit more detail your reasonings for not identifying the business, except to say that it's not one of the ones that you've seen mentioned on social media over the weekend.
Well, because this business is safe for people to go into, as safe as any other business. And I've said no business is 100% safe because we don't know, right? It was probably much less safe when the people who were working there didn't know they had COVID-19. Once we know they have COVID-19 now, they go home, they're isolated, the business cleans real well, and anyone else who had that kind of contact with that person is now in quarantine for 14 days. So the business is probably even maybe less risky than some other businesses because they've done a really good job of hopefully cleaning and making sure that everything's been decontaminated. But if I guess I just say this from the business standpoint. If I name a business and now everyone stops going there, and now that business doesn't even exist any longer and they're just as safe or not safe as any other business, it's not really fair to that business. So if they've done the right thing, then they go on and they continue to do the work. So we all want our businesses to be open. Everybody's been clamoring to get the economy back going. Open up the businesses, let them do what you want them to do so that you can go out and buy the things you want to do and get the services you need. And we don't want to be out there harming a business unnecessarily when there's no science behind that. And this is all based on science and on data. And so we have to think in those regards. And that's also goes back to why we haven't released names of people, because again, it's a privacy issue for that person. And not to say the business is a privacy issue, but the reputation of a business could become very bad when they really didn't do anything wrong. Someone that worked for them actually got sick. And so this is a tricky virus, as we know, and you can do a lot of things well, and you can still catch COVID-19. So we don't want to harm the business. And if the business is trying to do the best they can, just like I think so many businesses are, then we're going to continue to try to just work with them to continue to do better.
Is this the largest number of cases that have been tied to one business that you've seen since the pandemic started?
It may be close to the largest. We've had a couple other businesses that have had a number of cases. So this is not the first one that we've had like this. And again, it won't be the last. But it may be on, I just can't remember since the beginning, if we've had any that have had 6 or more. But it's probably close to the largest, if not the largest.
Thank you.
Sure. Talk Erie.
Good afternoon, Kathy. It's Joel Natale. Happy Monday to you. I want to dig a little bit deeper on this business because what we're finding is that even if a business wanted to be A+ in their cleaning, it's difficult to get the cleaning supplies, the wipes, and also they may not have the training to do the proper sanitation. Is the health department available to walk through, let's say, the housekeeping or the janitorial crews to do this type of work correctly, especially in those places maybe that are not in food service or not in the healthcare field, that they don't really even know how long you have to leave something soaking in sanitation fluid before the virus is killed and so on?
So we give them all the guidance that they need from the CDC. As I said, that's really where the guidance is coming from. And they are our national professionals who assist us in these type of things, along with our partners at the Pennsylvania Department of Health. And so obviously we're first talking to the person who is positive and getting them into isolation, but we're also in the meantime reaching out to the business to make sure that they know that they've had a positive employee, because they do have things that they have to do to protect not only the people coming in, but their other employees. And I think that's one thing that people need to understand here. The people who are most at risk are probably the fellow employees of the person who's positive, because you've had a much longer contact with them. Part of the thing with COVID-19 is not only do you have to be within that distance of 6 foot or less, and sometimes it could even be farther than that, but you also have to have some prolonged contact. Usually it's more than just seconds or even a minute or so. And so, of course, when you have employees working next to each other, so that's the first thing the business wants to do, is protect. They don't want this going through all their employees, which could take away their entire staff, and then they have no way to even keep operating. So it is, I think, crucial for a business, but I think they are so motivated to stop the spread of this in their own business that they'll do anything that is needed to get done. So I understand what you're saying, but I think any smart business person can read the guidelines. It's not rocket science. It is simply cleaning well with a disinfectant. A bleach works. Lots of different products work, but bleach is still pretty available in stores, and you can get that, and you can clean your surfaces very well and feel fairly confident that you have a disinfected location.
Thank you.
Sure. Erie News Now.
Hi, good afternoon. Hoping for a quick clarification and then a question. Is it that you choose not to tell us the business, that you legally could, but the county's making the decision not to announce?
I think legally I could, but I don't think it's very smart of me as the county executive who cares about our businesses here in this community to somehow put maybe a black blemish on a business who's really trying to do the right thing. And so, that's what we're trying to help our businesses here, as we have the whole time. And again, if we felt that there was a danger to the society as a whole, that would be different. But we don't feel that there's any more danger from this business as there is from any other business that anyone's going into right now.
Do you worry then, as you talked about speculation about this hurting other businesses, that by not announcing that name, that fuels speculation that could in turn hurt these businesses?
I can't stop rumors. You know, I mean, people spread rumors in this community and every other community all the time, and that's why I'm asking people to stop it. Stop spreading rumors that you don't know are true. You know, you're out there speculating that it's this business or that business, and it's wrong. It's only going to hurt our community. So if you want to do the right thing, wear your mask. I guess it comes down to that. Wear a mask, wash your hands, stay 6 feet away. Just do those things. Whatever store you're going into, stay as little time as you can inside of any store. Know what you want to do. Go in there, get what you need, get out. I mean, it's pretty basic stuff. And the businesses are working hard to protect you also. But I'm telling you what, those people who work at all those businesses that we want to go visit, they're on the front lines. We've talked about this for a long time. They are on the front lines. And do we want to ruin their job, their ability to make money and have a business close because they're out there trying to do their job? That maybe they would rather be home too, but they're willing to go stock those shelves for you, or they're willing to go sell that merchandise for you. They're willing to go out and prepare that food for you. So I think people need to really think about this in a very large sense. County Department of Health, county government is trying to protect you. We're not going to allow something to happen that is going to be any more dangerous than any other place. We close pools all the time. We close beaches all the time. We close restaurants, or we put out the critical violations. And we do that because there's something that the public needs to know that is dangerous to their health. And I guess the beach closures would be the best thing to say. If a beach has such a high level of harmful substances, E. coli or something, we close it down. We don't feel that way about this business, and this business is not a threat to the general public any more than walking inside of any building that you don't live in is right now.
And what is the process of notifying customers? You know, if I've been in there, how will I know if I've been in the affected business?
You
how do they go back and
won't
trace and try to
know.
figure that
You
out?
won't know. But if you come to us and you're positive, we'll ask you what you've been doing and where you've been, and we might make a connection to that. But if you were wearing your mask and everyone else was in there was wearing their mask, then your chance of getting COVID-19 was probably very, very low if you were inside that business. Very low. So I hope you were wearing your mask wherever you went, because that's what we've been telling you to do for the last few weeks. Is there any other media with us today? Okay. Then we'll go back to Jet.
Yep. Hi, Kathy. So let's transition a little bit. Obviously, we are now into the yellow phase, a couple of days in. Did Karen Tobin's team go out, I guess, to survey and see, I guess, the population that was wearing masks?
We've had our surveillance teams out, and they have seen good results. We've actually been really pleasantly surprised at how well things went over the last 3 days, where, you know, Friday, Saturday, and Sunday as businesses reopened. I myself personally witnessed really good practices in pretty much everywhere I was at over the weekend, and I think others have reported to me the same. So we're out there, you know, but we're also responding to complaints. I think the biggest complaint continues to be around masks, that either people aren't wearing them properly, or maybe sometimes people aren't wearing them, although I think most businesses have been very good about requiring those masks to be worn of anyone coming in.
Has there been any other talking to the governor or the state said that they aren't going to open salons or anything prior to the green phase, but has there been any mention of any relapse in that, possibly changing that, or are we still sticking by that?
So I was on a conference call earlier today with the Department of Community and Economic Development that they had with county officials, and that question was brought up specifically, and they basically said they will not be opening. They do not see that changing. As much as all of us could really use and want a haircut, those are not going to, because just of the simple difficulty, almost impossible, I guess, to keep your 6-foot social distance from somebody when you're cutting their hair. So until the state feels like we have a better control on the spread of COVID-19 in our Commonwealth, that is not going to happen as far as I can tell.
Then just a really quick follow-up to that, is there a fear of, I guess, residents possibly going to Ohio to get a haircut or anywhere of that nature?
You know, people are going to move around and do, I guess, what they want to do. You can't stop that. We're not, we're not policing that or whatever. And so people will do what they feel that I guess, whatever they want to do. But I'm just asking people to try to respect the things that are in place, because it's really what's helping to keep our community safe. And that's what we want, is we want to keep our community safe. We want to keep our neighbors safe. We want to keep our loved ones safe. And I guess we all just live with kind of crazy hair for a while. It's not, our hair is not a life and death situation, but getting COVID-19 could be. So I guess that's the choice.
Thanks.
Erie Times News.
Yes, Kathy, you talked about hair salons. What about anything else that was discussed today or over the weekend about possible changes for any particular type or group of businesses or organizations, such as summer camps or anything like that? Anything new to report on that?
So the question about summer camps came up at this meeting, and I know there's still some information that we have not gotten that we're hoping to get, and that was also kind of brought up on the call, was they don't have a clear answer on that yet. So we're waiting on that. No other new information, no other businesses that are going to be opening. I think a couple things that came through today, and I believe the governor might have mentioned this also in his press conference, is the insurance agent, the insurance business is saying, be careful if you are a business and you do not comply with the guidance that's out there, because it could affect, if you were sued down the road for something related to COVID-19, it could affect your ability to have your insurance coverage help you through that if you are not in compliance. So a business, for example, that would open, let's just say a hair salon decides, I'm not following this, I'm just going to open, I'm just going to start cutting hair. They could potentially be uninsured. And so those are the kind of warnings that are being put out there. This is by the insurance segment, not specifically by the governor or certainly not by the county. But I think businesses should be very clear with what they're doing and how that could affect their business in the long run.
And do you have any quantitative numbers on either how many businesses were able to open or a percentage of businesses in the county that were able to open?
I don't know that. I could check with the chamber and see if they have any of those kind of figures, because they have a much better pulse on the specific numbers of businesses in each segment. But we know that there's still, some really important businesses to all of us that are not open: our gyms, our spas, our hair salons, entertainment, which is a lot. We have a big tourism industry here, although the weather hasn't been quite conducive for our tourism activities, but all of those places are still closed too. Talk Erie?
Thank you.
Yes, hi. I want to switch to antibody testing, and this may not be something you could answer today, but the question has come up in that the antibody testing is starting to happen across the Commonwealth, and actually a case happened down in Cambria County by Johnstown, where 2 people had COVID-like symptoms back in December, and then, went away. It was way before, the pandemic blew across the nation, and now have gotten antibody testing. They tested positive that they had COVID-19, and their numbers from an illness that happened in December have been posted to the current tracking statewide and for their county. So my question to you is, are we doing antibody testing here, and is it possible that some of our testing, some of our case counts, if you will come from antibody testing? Because that's exactly what Rachel Levine said today in the press conference, that anything that comes up in an antibody test will get posted to our numbers, and that could really give us a spike.
I don't have any information about that, Joel, unfortunately, but I will ask, our medical consultant, who, is an infectious disease physician, about that. One of the things we did talk about, the new antigen test that was approved is still only 80% correct. So there's 20% of those who test and are could show a negative, so they're actually saying those people still need to go and get the full PCR test. I forget the actual acronym for that. But anyway, so I think there's still a lot of question about some of these tests and whether they're fully, I guess I want to say, fully vetted out yet to whether they can really give us the truth on these numbers or not. But, it's all really interesting, and I think the more we can get to testing and really find out, because I know people have said to me, I think I might have had it back, months ago, and maybe many of us did and didn't know it. So it'd be great if we get to that point where we can have that kind of testing available, but I will have to look into this more because I don't have any knowledge enough to speak to this.
Appreciate it.
Sure. Erie News Now.
Thanks. Just one more question on the business here. I guess just walk me through this. It's possible I could have been in this business with 6 employees who have COVID-19, and even if I was wearing a mask, they're wearing masks. Odds, of course, are very low that I would contract the disease. But still, I could have been in there with these people, interacting with one or more than one of them, and I could now be out here having no clue that I was in contact with them. Is that accurate?
That would be accurate. I mean, yeah, I don't know that you would have encountered all 6 people in any business that you would have been in, but I guess it could happen.
But it could have
But
been
again,
contact with one
if
or
you're
two
wearing
of
a mask and they're all wearing a mask, your risk of contacting COVID-19 from them is very, very low.
The doctors here in the Department of Health are telling you that this business is no more risk. I guess that's, I've just gotten so many text, phone calls, emails about this. Have doctors told you emphatically this business is no more risk to anyone else, and people who were in there, even when these employees were sick, should not be worried? And if that's the case, why not?
I think I've sort of answered this numerous times already, because your contact with them was probably minimal. Think about when you go into a store, how often are you with anyone who works in that store for any length of time? Maybe when you're going up to pay for your item, or maybe you stop someone and ask them where to find something. I mean, normally your contact is very short with these employees. If you have a mask on and they have a mask on, and they don't even know that they're sick yet, you leave there, you get your hand sanitizer out, or you wash your hands real good before you touch your face, your chances of picking up anything would be very low. So it's not, I don't even know what else to say, but yes, the physician who is our consultant, as well as those others who work in the Department of Health who do this stuff every day in and day out, have said that the risk is very, very low for anyone who is in that particular store. But you have been potentially in other stores where there's also been employees who then have come down with COVID-19. I don't even know how many stores any of us could have been in, because there's a lot of people, there's 120 people in Erie County who have had COVID-19 that we know of, and of course we know that there's people who've had it that never knew that they had it, and also were contagious. So there's a lot of chances that you could have been in some business somewhere along the line in these last couple months, 3 months, and you could have been at a business where someone actually was contagious with COVID-19. But here you are, months later, weeks later, and you don't have any symptoms either. So most likely, you didn't pick it up there. You really need to be close with somebody, and you need to be around them for a significant amount of time. But just that quick interaction, and that's why wearing those masks is really so crucial when you go into a business, and that the employees are all wearing the mask. That's going to be the best way we can protect each other.
Thanks so much. Appreciate it.
Sure. Jet TV, do you have any last questions?
Yeah, I have a few just last questions for you. So last week, of course, we had 19 cases over the course of 2 days. Do you know if any of those, speared off from the woman who broke her isolation?
I don't believe so, but I'm not positive about that.
And then overall, how is the isolation? So, of course, we haven't had any other incidents.
We've had none others. And as I reported last week, she then, after spending a night in jail, she was very, very cooperative, and as of Friday, was taken off of her isolation. And so we're thankful for that, and everyone else has done a great job. I mean, 120 people and only one incident of someone who we knew was not following their isolation. I think that's a pretty good record, considering that none of us really want to be told that we have to stay someplace for many, many days. But, people want to do the right thing, and I want to thank all of those who not only have been positive in an isolation, but I want to thank the hundreds and hundreds of people who have been asked to quarantine for 14 days, and they have also done a great job doing that.
And just one last question. I know you mentioned that the county could provide housing for anyone who could not properly isolate or quarantine at home. Have you had to do so?
We have.
Do you have a number on that?
I don't know how many total have been in that situation, but we have done it. It's been a handful of people at a time, but we have provided that. And again, we do it because it keeps people safe. It keeps our community safer. And that's what we're trying to do, is keep everyone as safe as we possibly can. We can't take away the risk totally. COVID-19 is here in our community, but we're trying to mitigate it as much as we can.
Thanks.
Erie Times News.
Yes, Kathy, you said you were pleasantly surprised with what the compliance seemed like for businesses and customers over the weekend. Do you know if any warnings or citations were given?
No citations, I don't think, and mostly it's just conversations. And, we call up to the business and say, this is what was observed, and do you have a plan? They tell us whether they have a plan or not. We had asked all businesses to have some kind of written plan, and then we discuss the violation, the concern that was raised in front of us, and to find out whether it's something that we need to go out there and check on or not. For the most part, we haven't had to go out and check on them. Their businesses want to comply. Again, there's not a single business that I can think of in Erie County who doesn't want to keep their customers healthy, who doesn't want to keep their employees healthy. So they're going to do everything they can to do the right thing, and that's great. They care about us. They care about you as you go and shop in their stores.
And then with just 6 cases over the weekend, over the last 3 days, after having 19 reported on Thursday and Friday, I just want to get your thoughts on that. I mean, it's a fairly low number. Do you think we've seen whatever surge we would have seen from that good weekend a couple weeks ago? And are you encouraged by the relatively low number of cases over the weekend?
Well, I'm encouraged by the low number of cases over the weekend, but there seems to be a little bit of a trend on the weekends having a little bit lower, and whether it's because people don't go see or don't connect with their doctor if they're not feeling good, and they will, on Monday, I don't know. But I hate to make predictions over a few days, because whenever I, get excited or think that, maybe we're kind of on the backside, then we, see kind of an uptick in our numbers. So it's so hard to predict where this virus is going and what's happening. But the one thing I will continue to say is our community is just in such a better place than so many others because of having the health department, having that contact tracing that's been going on since our first case, having hundreds and hundreds of people put into quarantine who have followed that quarantine and then not been out where they potentially could become sick and spread the virus even further. So we're really doing well here in terms of that, and we're going to continue to do that, and we'll see how it goes for the rest of the state. As we know, the Department of Health, the statewide Department of Health, is taking care of those 57 counties who don't have a health department, and that's a lot. It's a lot of people to cover. It's a lot of counties to have to deal with. So we'll see how that goes. Talk Erie. Do you have any final questions?
Just one quick one. What does the county operation look like under the yellow? Is your administrative team still working from home? Is OCY doing any house visits? Can people access services at the courthouse? Where do we stand right now with the yellow?
So we moved into remote working whenever a department could make that happen. And we still have as many people working remotely as we possibly can. But obviously there are some things that you have to be in the buildings for. The Office of Children and Youth is out there addressing any concerns that come in. Their calls have been greatly reduced coming in, and probably a lot of that is because the children in our community are no longer going to school where we have mandated reporters who might see something that would concern them and then contact the Office of Children and Youth. So that's a concern for us. But we hope that our children are safe wherever they're at, but we will respond to that. And of course, we know the libraries are closed, but many of our departments are working remotely or on a reduced level of people in the building, so they might rotate some people in and out. But we try to get everybody to be working remotely as much as we can, and we're going to keep them there as long as we're in the yellow phase, if they're able to get their job done. The courthouse and the work that's can be accessed by going into the courthouse will pretty much probably open on the 1st of June, when the courts go back into more of a regular session, and then there'll be greater access in and out of the building. But again, we'll have the masking guidelines, as well as trying to keep people 6 foot of distance from each other. And we may be doing some other things, but we're looking at that as we get closer to the June 1st date. Thank you for that question. And Erie News Now, do you have any final questions?
Just one, please. About contact tracers, how are we doing in terms of, A, trying to hire more? I know jobs have been posted. Wondered if you had responses to those, a lot of people looking into it. And then, B, does the slightly slower weekend here in terms of cases, have contact tracers been able to stay on top of things after that big spike where things now have calmed back down a little bit?
Well, it has been a little bit of a relief for the contact tracers we do have. They could take a breath, right? Because they were very, very busy there for a couple days. So that's been helpful. We did get many applications, and so the team is sifting through those today, and we are going to do sort of a quick interview process to try to get some people in and trained and ready to help out. You know, I think it's important to remember that so many of the team on this COVID-19 pandemic incident command have been working long hours and many days really since early March. And so there's a little bit of a burnout that's starting to occur, and so I think we need to get some people in to help, you know, give some relief for the weekends and for the other times when we have large numbers. So we're grateful to all of those who applied for those 2 positions that we have open, and we hope to get some people up and running pretty quickly. So I appreciate that. Well, thank you all for joining me again here on Monday, and I will be here Monday, Tuesday, Wednesday, Thursday, Friday this week, and we will be giving a briefing and hopefully have some great guests with us. And I want to just call out one thing today, inviting you to look at the Light the Playhouse event, which is our legendary playhouse, one of the oldest community playhouses in the entire country. And it's been a staple here in Erie County for generations, has launched a campaign to raise $150,000 to light the Playhouse marquee at their house in the Lecom stage. So if you're able, and it's a facility that you really care about and you want to contribute to the Playhouse, you have until July 1st to help them light the Playhouse. So visit erieplayhouse.org and fill out that donation form, or call them at the Playhouse and speak to them. Or you can also email Kate at erieplayhouse.org, who is the executive director, and that's Kate at erieplayhouse.org. So finally, again, stay home as much as you can. Wear your mask when you do go out, and please remember to stay safe, and please stay calm. Thank you.